It's Patrik Hutzel from intensivecarehome.com, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies, and where we also provide tailor-made solutions for hospitals and intensive care units, whilst providing quality care for long-term ventilated adults and children with tracheostomies. Otherwise medically complex adults and children at home, which includes home BIPAP, home CPAP, also home tracheostomy care for adults and children that are not ventilated, also home TPN, home IV potassium infusions, home IV magnesium infusions, home IV antibiotics. We also provide port management, central line management, PICC line management, as well as Hickman's line management, as well as palliative care services at home. Now, in today's blog post, I want to answer a question from Sanya. Now, let me read out the question from Sanya, who says, "Hi, Patrik. I have my 9-month-old baby girl in intensive care. She had 4 failed extubations, so she had to have a tracheostomy and has been stuck on a ventilator since May last year. Her respiratory rate has been high since birth. When she's asleep, it's between 50 and 60 breaths per minute, but when she's awake, it's anything between 70 to 90 breaths per minute. She currently has a PEEP of 10 and pressure control and pressure support of 6, respectively. Do you have any advice on how we are able to wean her off? She has no airway issues. CT scan was okay. The only thing that the doctors say is that her lung volume is less than a baby her age." Well, thank you so much, Sanya, for sending through this question. So, well, first off, you need to establish what ventilation setting she's in. Is she in a controlled ventilation mode, such as SIMV or ACV, where the machine is delivering a set number of breaths per minute? Or is she in a CPAP or pressure support ventilation mode, where she's triggering most of the breaths herself? Is she, passing any spontaneous breathing trials? You haven't elaborated on that. Has she been off the ventilator at all, even if it's only for 5 or for 10 minutes? Even that would be a starting point. In terms of weaning your daughter off the ventilator, it should be similar. It's not dissimilar to many other adult patients. Mobilization, stopping sedation, stopping opiates. Mobilization would be first and foremost. Reducing PEEP, reducing pressure support, reducing oxygen levels, as much as you can, and getting her to breathe on CPAP pressure support more and more. And once she can do that more than 24 hours a day, put her on a T-piece and see what happens. Now, if that can't be achieved, other strategies here could be, if lung volume is decreased, she could potentially have a tracheostomy. Many ICUs are doing that, do a bronchoscopy, which is putting a video camera down in the lungs and see what's going on there. Also, with lung volume being decreased, why is that? Is she having secretions? Why is lung volume decreased? Was she prematurely born? Is lung surfactant not developed? You haven't elaborated on any of that, but those would be things that I would be asking them and see what the answers are. If your daughter cannot be weaned off the ventilator, then clearly intensive care at home is the best next step. She shouldn't be in ICU for 9 months, which is too long. You're living there, you and your family are probably living there to be with her, and that's not a good environment. So she'll be much better off at home than in ICU in the long run, if she can't be weaned. And once she's in her own home environment, maybe weaning will take place with a team of ICU professionals around that can facilitate the weaning in a much better patient and family environment, which is a home care environment, no question about that. So that would be my advice here, especially since it's been 9 months. That's not a good environment to be in after 9 months. You want your daughter to be at home. I'm sure you want to be around your family at home and so forth. So that would be my advice here. And if you do want your daughter at home, you should reach out to us here at intensivecareathome.com. Now, with intensive care at home, we are currently operating all around Australia, in all regional rural areas, in all major metropolitan areas. And we are an NDIS accredited service provider. We are a TAC approved service provider in Victoria, iCare in New South Wales, NIISQ in Queensland. We're also DVA approved all around Australia. We have received funding through public hospitals, private health funds, as well as departments of health. So we're also providing level 2 and level 3 NDIS support coordination, which would be critical in a situation like that, to get on the NDIS scheme. Now, also what is very important to know is that we practice intensive care at home according to the evidence-based mechanical home ventilation guidelines, and I encourage you to have a look there, because we exclusively work with intensive care / pediatric intensive care nurses with a minimum of 2 years pediatric intensive care or adult intensive care experience, which puts us in a position where we employ hundreds of years of intensive care nursing experience in the community, which is really unmatched. We are the only service provider in Australia that has third-party accreditation for intensive care at home. No other service has built the accreditation and has built the intellectual property that we have built. Also, we are also sending our critical care nurses into people's homes and into residential aged care facilities to avoid emergency department admissions, ED admissions, and provide an emergency bypass service. If your hospital is interested in doing the same for your ED, please reach out to us. Now, also, if you are an NDIS support coordinator and you are looking for nursing care for one of your participants, please reach out to us. Or if you don't know how to go about getting nursing care through the NDIS or through other insurance schemes, please reach out to us. We have done most of the advocacy for our clients. We've been heavily involved, been written lots of reports and stuff. And we also do NDIS nursing assessments and other nursing assessments, specialist nursing assessments in particular. And if you are a critical care nurse and you have a minimum of 2 years critical care nursing experience, ideally with a postgraduate critical care qualification, we want to hear from you. We currently have jobs in Sydney, Melbourne, Brisbane, in Albury, Wodonga, in Bendigo, in Warragul. So we have a wide variety of job opportunities for critical care nurses that have the right mindset and have the right skills. Also, we are not an agency. We are a service provider that has a tailor-made solution for our clients, and we pride ourselves on that. That means if you are a critical care nurse interested in working with intensive care at home, we're really looking for staff that can give us regular availabilities that are reliable. Reliability is not negotiable at all. Our clients want regular staff. We want regular staff. That's why we have a tailor-made solution for our clients. We don't have people that come and go. That doesn't work for us. So if you're looking for agency work, please don't come to us. We're looking for reliable people that want to make a difference to our clients and their families' life, and that want to build relationships with our clients, but also with us as an organization, of course. Now, if you're at home already and you have insufficient support, or if you are in intensive care, similar to our, reader here, Sanya, who has their baby girl in intensive care, we can help you going home, of course, or you and your family to go home. And if you're at home already and you have insufficient support, you have regular ICU readmissions, you have people coming and going that don't know what to do with a tracheostomy or a ventilator. I was just in a meeting yesterday with a client or potential client who's at home already. They said they have registered nurses who don't know what to do with a tracheostomy. Well, there's no surprise there, because it takes an intensive care nurse or a critical care nurse to know how to handle a tracheostomy, either in ICU or at home. That's why we are the specialists on tracheostomy and ventilator care at home. Now, And if you are an intensivist, intensive care consultant, and you're looking for a career change, we are also currently expanding our medical team. And if you're an intensive care specialist, ICU consultant working in ICU, and you have bed blocks, which I know you do, we want to hear from you as well. We can help you eliminate and manage your bed blocks. And if you're a hospital executive watching this, we also want to hear from you, because once again, I know you've got bed blocks in your hospital and in your ICU and in your ED. We can help you eliminate all of that, and you don't even pay for it. So please reach out to us as well. All of that you get at intensivecarehome.com. Call us on one of the numbers on the top of our website, or send us an email to info@intensivecarehome.com. And lastly, if you are in the US or in the UK and you need help, please reach out to us as well. We can help you privately. Now, and if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share the video with your friends and families, share it far and wide, and comment below what you want to see next or what questions and insights you have from this video. Thank you so much for watching. This is Patrik Hutzel from intensivecarehome.com, and I will talk to you in a few days. Take care for now.